Good day to our respected lecturer and our fellow peers. My name is Lim Jiasian and I'm the project manager for the Group A2. Today, our team is incredibly proud to present our A252 project proposal. The UUM SmartHealth portal is a comprehensive digital healthcare system engineered specifically for the UUM Utara Malaysia Health Center. Before we dive into the operational challenges of the clinic, I would like to briefly introduce the project management team behind the proposal. We structure our team using a strict RACI accountability framework to ensure every phase of the project lifecycle was professionally governed. As the project manager, I oversaw the project institutional alignment, scope baselines, and overall closure. Now, let me introduce my fellow teams. First is Ambarasan. He's our business analyst who quantified our business case and organizational value. Next is Muhammad Danish. He's our planning lead who will architecture our work breakdown structure and 24-week schedule. Third is Noor Amir. He's our risk and quality lead who will build our risk mitigation and quality assurance frameworks. Thirdly is Afan Hakim, which is our communication lead, will manage our stakeholder engagement and change protocol processes. Together, we have designed a project that utilizes a hybrid IT project management lifecycle to deliver a secure cloud-native healthcare solution. Now, let us move to the organizational context to understand exactly who our client is and why this project is so critical. Our target organization is the Pusat Kesihatan University PKU. PKU serves as the primary frontline healthcare provider for the entire Sintok campus, managing the medical needs, pharmaceutical distributions, and emergency triage for a population exceeding 30,000 active students and staff members. Now you will ask, why does this project matter right now? Currently, UUM is making massive strides under the UUM ICT Smart Campus initiative. However, PKU has remained structurally isolated from this digital transformation. The clinic currently operates a highly vulnerable legacy analog framework that relies almost entirely on physical paper folders, handwritten charts, and manual coordination. Operating a paper-bound clinic for a population of 30,000 people creates severe systematic friction. During peak academic weeks or campus flu waves, this manual infrastructure simply buckles under the pressure of over 450 daily walk-in patients. Modernizing this ecosystem to a cloud-native platform is not just about IT convenience, it is an urgent necessity. This project matters because it is the only way to remove critical healthcare bottlenecks, eliminate the risk of lost medical data, and ultimately guarantee patient safety on our campus. To explain exactly how these bottlenecks are impacting our stakeholders and how we intend to solve them, I will now hand over the presentation to our business analyst Amrasan. Thank you very much.
Moving on to next slide, problem and opportunity analysis. Right now, PKU runs on a fully paper-based system. So every single patient file is physical with no backups, no quick search, and no shared access. On average, staff take 20 minutes just to retrieve one file, and admin staff lost 18 hours a week simply sorting paperwork. So on the pharmacy side, handwritten slips cause a 12% mismatch rate in inventory, which is a real patient safety risk. So during peak periods, we see more than 450 daily walks in, and patients wait an average of 150 minutes. So this isn't just an inconvenient, but it's overcrowding like this also raises the risk of cross infection on campus. So from our project, management perspective, this is our problem statement. So the scope of the project exists to solve these exact pain points for the people most affected, including students, medical officers, nurses, and pharmacists. Moving on to the next part, which is measurable organizational value. So our MOV is a simple to state. Over a 12-month post-implementation period, we want to optimize PKU's operational capacity and patients' care efficiency, mainly by cutting wait time and digitalized records. So our headline target is a 40% reduction in wait time and bringing consultation wait down to 27 minutes or less from 45 minutes baseline. Alongside that, we are aiming for 100% we're aiming for 100% digitalize of core workflows, a 60% drop in paper-related overhead, saving roughly 9,000 ringgit a month, and a clinical safety target of no more than 2.2 errors per on 1,000 orders, which is 60% improvement. So these four metrics are how we will know concretely whether this project deliverable real value. Now moving on to the business case snapshot. So the project needs an estimated capital expenditure of 280,000 ringgit and the numbers support it. So both technical and economic feasibility came back high with break even expected within one and a half to 2 years, while operational feasibility is medium to high. So we also looked at two alternatives by buying a commercial EHR was too expensive and too rigid for UUM's workflows, and simply adding more stuff to the legacy system would not fix the root problem. So instead of this system saves 18 hours a week of admin work per staff member, cuts physical storage by 80%, and speeds up our pharmacy dispensing by 35%. So in shortly, the investment pays for itself, fixes the real issue and beats the alternatives.
Thank you. Moving on the core framework of our education, let's look at our project center highlights. Our primary objective is to deliver the core curriculum modules of the UM SmartHealth for every quarter academic data. Ensure high availability and low latency for over 30,000 users to achieve this. Our high-level scope focus on five key pillars: a web-based creation portal for mobile process access and encrypted EHR system to secure patient medical history, dynamic booking for real-time scheduling, seamless SSO integration with UAM ID application, and strict role-based access controls. Successfully executing this requires close collaboration with our key stakeholders, which is include the PKU clinic staff as our primary user, UM students, the UAM IT department for hosting infrastructure, and the SEA for instructional policy alignment. Finally, our project operates under strict boundaries, a timeline constraint of 34 weeks, a total budget of 280,000 ringgit, and a commitment to actively managing our top critical risks, specifically data privacy, expert, server latency, and user resistance. To keep delivery on track, we have strictly defined what is in and out of scope. Each scope feature included the patient interface, secure role-based access, automated pharmacy queuing, and UMID integration. Out of scope for this case, I live telemedicine, RS repass, and national database link. We manage this using a clear egg phase breakdown structure. We begin with initial requirements gathering, moving into system design and development. On speed, we proceed to testing and QA, migrate the legacy data, deploy the live platform, and conclude with formal project closing. To be a realistic schedule, we combine two estimation methods. We use bottom-up estimation for granular technical modules to ensure coding accuracy and balance it with analogous estimation by benchmarking against previous UM campus portal projects. This gives us solid 34-week roadmap with clear milestones. The charter is approved by week 2 and core development completely wraps up by week 16. We finish user acceptance testing and data migration by week 20. It will go live by week 22 and close out with a post-implementation review at week 34 to verify our performance metrics. Thank you. I will now pass the floor to the next speaker.
Hello, Assalamualaikum warahmatullahi taala wabarakatuh. Okay, my name is Nur Sharon bin Muhammad Afindi. Today, I want to talk about budget and symmetrics. Okay, for this project, next I will explain the project budget and the symmetrics by the UUM SmartHealth portal. The, the total project capex is estimate is 280,000 ringgit Malaysian, covering system development, cloud infrastructure, and staff training program during the 24 weeks of implementation. This budget ensures that both technical and operational requirements are fully supported. To ensure clear accountability, we use asymmetric, which is defined who is responsible, accountable, consultant, and informed for key deliverables. The project manager oversees project governance, user acceptance tests, and project handover. The business analysis focus on defining measurable objectives and preparing the business case. The planning lead manage project scope, work breakdown structure, and milestone tracking. The risk and quality lead handle budget control, risk mitigation, and quality management. Finally, the communication lead coordinate stakeholder communication. Communication lead coordinate stakeholder communication and change management activities. This structure ensure efficient collaboration, accountability, and successful project delivery. For the next slide, I want to talk about risk, quality, and stakeholder governance. This slide our approach to risk management, quality assurance, and stakeholder governance. For risk mitigation, we identify three key risks. First, data exposure. The data exposure during migration will be prevent to AES 256 encryption and strict role-based access control. Second, severe latency during peak stage usage will be addressed through load testing and cloud auto-scaling. Third, staff resistance. The staff resistance to the new system will be reduced through early involvement in user acceptance tests and target training session. For quality assurance, we aim to achieve 100% data accuracy during migration to ensure the system can handle peak campus traffic and provide a fast and responsive user experience across core modules. Stakeholder engagement is also critical. PKU doctor and nurse will be actively involved in testing and workflow validation, while UUM senior management provides strategic guidance and approval. So to maintain our transparency, communication will be conducted through bi-weekly sponsor reports, weekly technical meetings, and pre-lunch announcement to students. That's all from me. Thank you.
Hello, hi everyone. My name is Al-Hakim Azrin, entry number 307238. Now, I will explain how we will control and monitor the progress of the UUM SmartHealth portal project to ensure it stays on track throughout its implementation. Firstly, we will use a formal change control process. Whenever there is a request to modify the project scope, features, and requirement, stakeholder must submit a change request. The project team will then assess the impact in terms of cost, schedule, resources, and technical feasibility before making any decision. Finally, any major change must receive approval from the UUM ICT Steering Committee before they are implemented. To monitor the project progress, we will track several important indicators. These include monitoring the completion of tasks based on the work breakdown, structure, tracking milestone, achievement, and critical path. And identifying defect during the testing and quality assurance phase. In addition, we will prepare regular status report using key project metrics such as schedule variance, which measure whether the project is ahead or behind schedule. Burn rate, which track budget consumption. Velocity, which measure the team's development progress. And the risk log, which record and monitors active project risk. By continuously monitoring these indicators, the project team can quickly identify issue and take corrective action before they become the major problems.
Next, I will explain our implementation and post-launch strategy. The SmartHealth portal will be introduced using a phased rollout approach to minimize risk and ensure system stability. During phase 1, the project will focus on deploying the initial digital patient record system with the essential features. In phase 2, we will expand the system by introducing pharmacy service and electronic health record modules. Finally, phase 3 will complete the digital transformation by securely achieving legacy paper-based medical record. Besides implementation, user red line is equally important. Therefore, comprehensive training session will be provided for doctors, nurse, front desk staff, and students. Easy to follow user manual will also be prepared to support daily operation and encourage smooth system adoption. To evaluate project success, the MOV, or we call as measurable organizational value, will be assessed after 6 months. Performance indicators, especially the target of reducing patient waiting time by 60%, will be reviewed to ensure the project deliver its intended benefit. Looking ahead, we also recommend several future improvements. These include establishing organizational policies for digital medical certificate, integrating artificial intelligence through an AI system checker chatbot to assist patients with with preliminary health support and conducting regular security audit every 12 months to maintain high standard of cybersecurity. Now, to conclude our recommendation is that the UUM Smart Health Portal project should proceed based on our analysis. The project is both technically and financially feasible. It can be complete within the planned 24-week timeline while staying within the allocated budget of RM 280,000 by using proven cloud native technologies. From an operational perspective, the system is expected to improve healthcare efficiency significantly. It is estimated to save approximately 16 administrative hours per week, allowing healthcare staff to focus more on patient care while increasing the overall service capacity. Strategically, this project aligns with UEM vision of becoming a modern smart campus. It replaced outdated manual process with an integrated digital healthcare system that improve efficiency, accessibility, and service equality for the entire university community. In conclusion, we confidently recommend the implementation of UUM Smart Health portal because it provides long-term value, enhance healthcare service, and support UUM digital transformation goal. Thank you. That's all from me.